Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare. Krishna. Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare. I attended a Zoom session recently, and it was an open session for discussion, and the topic came up that one of the devotees present in the meeting wanted to know about what happens to someone who has some health issue. How much do they focus on the health issue? Do they just ignore it and just chant Hare Krishna? Or do they try to find some remedies? What do they do about it? Because we're not these bodies, right? So the discussion went around, and the devotee explained that they had a personal health issue that they'd been struggling with for a couple of weeks. They didn't say specifically what was causing it, but they were experiencing some pain. So they wanted to know what they should do. Just ignore the pain? Or, I hate to say it, but although we treat these as philosophical issues, it's more in the line of just common sense. If you're experiencing pain, you're going to find out what's causing the pain and then see what to do about remedying it. It would just appear to be common sense, but it opened up a big debate and a big discussion about, and people were sharing different stories about relatives that died of terrible diseases and how they didn't pay attention. They reached a point where they just weren't going to bother having treatments or remedies or researching anything. And so meanwhile, this devotee is sitting there and they're in pain. And everyone's discussing how they should understand the situation and karma. Well, when there's pain, it's your own karma because... And the devotee's sitting there in pain. So I sent a private message. It wasn't philosophical, but I had some feelings for the person sitting there in pain. So I said, well, first thing is just to find out what's causing it, get some diagnosis. And then it might be a very simple thing, some simple little thing you can do. And then I shared what I'd been dealing with some sciatica pain in my leg. And I did a little research. And it turns out when you're sleeping, you put a pillow in a certain way, it fixes it. And sure enough. So I noticed no one actually said to the devotee that they hoped they would be feeling better soon. There was no personal extending, nothing personal to that devotee. It was just, they're sitting there, try and picture it, they're in pain, they're sitting there, and everybody's philosophizing about how to deal with, but nobody says, I hope you feel better soon. Hare Krishna. So it's kind of like that in the movement right now. It's very philosophical, very high plane, but where is the loving care for each other? So but where is the loving care for each other? So the conclusion was that the real care is that to become Krishna conscious. That's the real necessity. Just become Krishna conscious. So how is that expressed in real time? No one can say, we hope you feel better soon. That's not Krishna conscious. So I like to attend these meetings because it tends to always be like that. Very philosophical while someone's dying in the road. You can at least give them a blanket, It's not. Krishna. Interesting. I hope they're feeling better soon. Krishna.